APA formatter, the grammar guru, and the narrator for the PowerPoint presentation today. The other members of my group are Jacqueline Brugman, who is a contact fact checker, Christina Giordano, who is the activity guru, and Jasmine Roldan, who is a video guru. The topic today is teaching strategies for adolescence and puberty in the school environment. I already gave you our name. The creative activity that we've given is called Get Out of Here game. The game consists of 2 to 3 students in a group. They will work together and review the crossword puzzle. And the reward for doing that is they get to leave class a little bit earlier. We chose this game because it provides a great incentive for students to want to pay attention in class, and it helps them get engaged as well. There's a link on this PowerPoint for the crossword puzzle. The key characteristics of adolescents are that they seek independence, are naturally curious, they're motivated by lessons they relate to. For example, a lesson that might involve music they listen to or shows they watch. This will increase their level of engagement. They prefer active involvement while learning, such as playing games, like our crossword puzzle, and they prefer interaction with peers while learning. Having assignments that include collaboration can help them become more interested in learning. Some of the teaching strategies that target these characteristics are to be aware of developmental changes. Make sure you're aware of these. Students at this age develop at different times, so it's important to keep in mind all of these changes. You should also encourage movement as much as possible. This will help to keep them engaged and alert so they don't fall asleep. You should give students tasks to help them out in the classroom, such as passing out assignments or cleaning the dry erase board. You should use games to review material. Winning a game normally comes with an incentive, and it's a great way to motivate students. You should also encourage interactions with peers. For example, when a game is played, you can break the students up into groups and make it a collaborative activity. It's important to allow flexibility in the assignments to facilitate student self-expression and choose relatable topics. The more relatable the topics, the better, because they perform better on the assignment that they're given. Also using carrying methods of instruction. Then we move on to what is puberty. Puberty is defined as when a child moves through a series of significant natural and healthy changes. These changes include physical changes, psychological, and emotional changes. These are signals that show parents and teachers that a child is moving from childhood to adolescence. The changes in puberty include physical growth and development both inside and outside of a child's body. Changes to the children's sexual organs, brain changes, and social, and we all know, emotional changes. Puberty usually starts with girls between 10 and 11 years old. It is not abnormal, though, for girls to start anywhere from 8 to 13 years old. Boys are usually 11 to 13 years old, but again, it's not abnormal for the range to begin around 9 to 14 years old. Puberty can be complete in about 18 months, but it can take up to 5 years, which is also considered to be a normal range. Other changes that occur during puberty. The brain. The brain affects the child's behavior and social skills. They develop improved control, skills in planning, problem solving, and even decision making. These continue to improve until the mid-20s. Emotional changes are also found in adolescents beginning puberty. Their moods and feelings begin to change. They are sensitive to others, more sensitive than usual. They're self-conscious about themselves, their bodies, and things that's going on around them. And their decision-making is sometimes based on their emotions. Puberty in children with special needs. These children go through the same physical changes in the same ways as other children without special needs do. Sometimes there are delays due to chronic health problems, which can even delay the onset of puberty. How an adolescent manages puberty emotionally may be affected by his special needs as well. If you have any questions, please consult your health professionals to get answers for any questions that may help your child. In conclusion, at the end of the day, when adolescents begin going through puberty, it affects them socially, emotionally, mentally, physically, and sometimes they become even a little more aggressive. The important thing to remember as educators is to ensure that your students are able to have someone to talk to for answers to their questions, for emotional roller coasters they may be going through, and for changes in their friends and peers. Educators must maintain professionalism, refer students to the appropriate professionals for whatever situation they may be facing. But most importantly, be alert, listen, and be patient. Model for your students and allow them to have a voice. And these are our references. Thank you.